So hello
Yes, yes, sir.
everyone, myself Dr. Sandeep Dahilekar, Professor, Rog Nidan Department, Parul Institute of Ayurveda, Parul University, Limra, Vadodara. Today we have our 77th pedagogy session and our host is Dr. Sangeeta Toshikane madam and she is from Panchkarma department, HOD and professor.
So coming to the next departmental activities, the outstanding features we can have for the department like innovative actions. This time, Dr. Dean sir has just motivated us, our department, to project some innovations in for the PG project as a research activity. So we have just given their PG research activities as a instrument development itself, designing the instruments, that is Basti Sammilana Yantra as well as modified Janavasti Yantra. So we can have some videos regarding that Basti Sammilana Yantra.
Video is running madam.
It's not getting muted. Just
Yes, we can see the video.
oh, so it is not getting mute, sir.
No, no
Okay,
problem.
so hope so. It is yeah. So this is the yeah. This is the Janavasti Yantra. So both of them have done a very hard work in just doing all these things, and these projects are being for the IPR this one file now. Next one, we can just go ahead with the outstanding features only. These are the published books. From 1920, we have the published books for 6 only. It has been started again, the motivation through our principal, sir. So these are the articles and the books published by PGs. Since from 1617 we are having the article publications. So overall 42 publications have been done. Some are many are indexed and some are just peer reviewed because of later on we came to know that indexed articles are much more important, and you are just seeing from 1718 we have much of the articles are indexed only, and book publications by PGs are 6. I have already gone through that one. And now coming to the achievements of the departments, everything goes on the basis of the credit goes to the faculties, the credit goes to even all the mentors who have the made the our PGs, even the UGs also, I must say. These achievements are because of them, and it is through the PGs the department is growing. Uh, Here we can just say the achievement, we can just I'm proud enough to say that 3 gold medalists in our department. Dr. Shaheen Patel, she's from first batch of PG batch, and Dr. Imtiaz Hussain is from 1819 batch, and Kritika Thakur is also. Every year consistently we are have bagged the gold medal from and have made the department very much proud. So next one, the achievements are this is about the best thesis award have been just announced last year, 2020, Dr. Payal Patel. It is being done with the collaboration of RSPK department, and Dr. Anita Joshi ma'am was the co-guide also for her, Dr. Payal Patel. So she has done the standardization of the procedure over the Basti preparation itself. So she got this award because of that, or must be because the BRS member found it is a best thesis. That's why. And next one is best research associate award. We got as well as the Dr. Neha Patel over you are just seeing. She been associated with some research. Research, a company research, Adut Papeshwar research project, and we have completed that research project also very recently, 2022. And the PGs you are just seeing over here, Vikram Sarabhai getting the innovation award last year. Dr. Mehul and Dr. Neha Patel. So my projections, today's projections is only based on the post-graduations and post-graduations achievements itself. It is the department wholly it is running through the achievements. We the mentors are behind them, and we are projecting them. They are the faces of us. All these achievements, everything, it goes again to the mentors as well. It is a credit to the mentors as well. And next one is the achievement. Again, the Vikram Sarabhai, Dr. Dinesh Patil, and myself, we are getting the innovation awards over here because of the PGs itself. They have done their achievements, and we too are the mentors for that. And next one, a PhD awards of the department. Uh, uh, we are having the 3 PhD awardees in the department now, as well as running PhD scholars also. PhD scholars, running scholars are almost 18 number now, and almost 3 batches of PhD scholars have been just taken care, and Dr. Mahesh, Dr. Divya, and myself have gained the PhD award since last years. And these are the next, coming to the activities of the department itself. That is the best practices I am taking here. As per the NAC displays, a digital display. So I'm just going through and projecting my department like this. So we every day, as being the clinical department, every day by 9:15, Dhanvantri Stavana will be, a prayer will be always, it is being uttered by our therapists over there. So you're seeing over here the Dhanvantri prayer, and we are practicing each time the birthday celebrations of each one over here, and we are having the induction as per the induction, as well as the introduction to the department. A new faculty induction will be done there at the department, and best practices are still there. I am coming to them. PG, now the PG presentation activities will be there at the department, like the PG presentations are many actually, and very recently I have taken over here. That is, we are proud enough to say our other faculties, other faculty departments also had these types of activities there. But Dr. Anjali Gaikwad, she has presented very recently the PG orientation class set by the topic set by the NCSM regulations over there, as a part of a samskara to first year PG um, uh, induction classes. So next one is a presentation done at the World Ayurveda Congress at Goa, Panji, Goa. A short film festival has occurred, and our one of our PG scholar, Dr. Vikas Chauhan, so he has presented the short film over there with the topic 5G, a threat in the era. Next one about the post presentations have just gathered over here. The post presentations done by scholars, and it's a participation itself, and we are proud enough to have so many other post presentations also by our scholars at different seminars as well as the conferences, and this is taken from the Ayurveda Expo at Panji, Goa. And next, again coming to the best practices of the department over here. So many success stories we have regarding the patients review is also there. I have so many videos along with me, so I have attached that one so that my words, instead of my words, you can just see the pictures and just have the look over. So this is the one small if you just hear. I hope so it is not clear that much. Hope so it is not clear. Audio is not clear. Probably okay. So next, coming for the best practices. So these you can see the different, I cannot say the pictures itself they are saying. So these are the different therapies we are conducting for the different diseases over different conditions. We are doing that one, that is Patra Agni Karmas, Vamana Karma, Agni Karma, different type of Agni Karma, Shalak Agni Karma, Jalauka Charana, Parisheka, as well as here also Bindu Agni Karma, Rakta Mokshana, Nasya Karma, wet cupping is everything is we are just allowing the PGs to act also, even along with the therapists. This is Udvartana, Shirodhara. We have the actual schedules for the PGs there. Day-to-day schedule is there, and accordingly we are going ahead with the procedure presentations, even to the UGs also. These are continuing with the practices, procedures by the PG scholars. So by Basti Putaka, they are trying even with the traditional aspects also, traditional methods also. Dhumanasya Karma in different conditions like Avabahuka as well as the Manya Samba. Shiro Basti, you are seeing over here, Basti Dana, Arkapatra Svedana Karmas for conditions like Katigraha, Shirolepana for conditions like hypertension, as well as for the conditions like Palitya, as well as the conditions like Madhumeha, Sadyovamana. These are the each every day some one or the either procedures will be going on over here. So nearly we have now 132 procedures each day. They are going on. Sadyomana, among Sadyomana, 3 to 4 Sadyomanas we are conducting each day almost at the time. And these are the best practices, procedures I have gone through, and these are the departmental activities as per I have said. There are departmental seminars as a schedule. Weekly we are having one departmental seminar. Clinical demonstrations for the PGs each day we are having. Each day we have scheduled for them for the UG as a practical purpose also for 2 years, 2 hours, especially for the procedure presentations, as well as SOP presentations, and a mode of action of the clinical presentation has to be set by the PG scholars. So each day they have to just study and come. So the academically also as well as the clinically also, they are much more exposed. Yeah, expressions will be, yeah, much more they can exhibit themselves over here. And these are the practicals, those things only I was telling. And coming to the next slide, departmental activities again going on over here. So clinical as well as a theory presentations by the PGs to the UGs. The mentors will be there along with them always, and wherever they are having some mistakes, yeah, having some difficulties in exhibiting their opinions, then the mentors will help them regarding that. And we have each day the evaluation system of PGs after these presentations, that is clinical as well as theory presentations, and we make them to assure that to overcome with those any hindrances, yeah, any hesitations are there in the evaluations there. So students are improving by themselves by these things. And another thing is camp activities. It is a regular practice there. So many camp activities, usually monthly base, we are conducting 10 to 20 per month. The camp activities will be going on, and they are going to this UG PGs also, as well as along with the staff also. And because of this we are maintaining the hospital bed occupancy also nearly by 25 to 30 each day we are maintaining them, the patients. And the different types of patients we are getting from these camps, and we are happy and proud enough from our department of for our department that we are getting the patients, and scholars are getting exposures to so much of the different types, varieties of the patients over here. And next one is so these are the departmental activities I just gone through. And this is the actually starting with, now I'm just introducing the departmental PGs, our PGs teams over here from 2016, the batches. So this is a 2016 2017 batch. It's the first batch started and headed by Dr. Rohini ma'am. You can just see over this, these are the actual key persons started this department over here. And I have just joined when the first batch has just finished their examination. I was the actually internal examiner for the first batch. So I'm proud enough for this batch. All the batch students, they are they are in our prominent employers, as well as they some either they are in a clinical side, yeah, either in the academic side. So this is a 16-17 batch, and this is the outstanding our alumni batch, that from 17 to 18 batch. Again I must say all of them, the smiling faces over here, so they are they have got absorbed into the academic as well as the this clinical they are practicing. And this is another batch, 18-19 batch. the same thing again over here. And many of them in this batch, they are into the academic lines itself. They have one or the either institution they have got attached with. And this is the again the alumni batch, a last alumni batch, 1920 batch. It is very recent batch, and you are just noticing Dr. Neha Patel over here. So we have absorbed her, and Dr. Divya S. So she's also our alumni. She's absorbed into a PIAR now. So both of these people, they are our alumni as well as our faculty, PIA as well as PIR faculty members. And this is a last batch, a 1920 batch, and this is current batch now. So we are expecting now they are outgoing batch 2021. This is the second year batch now going on, and they have just submitted their synopsis also, and they are about to fill the CTRI now also. And this is a very recent batch, a very fresh batch we have got, 22-23 at the time of Shishopanana in this picture. So these are the actual the introduction of the PGs over there, and events organized for the students and staff are we have last 2022 we have this 21 we had a event. 22 we haven't gone through any of the events there. The Jeernodhara event has been conducted. It is a webinar webinar conducted by the department. And this is 21 COVID duties by our PGs has been scheduled for the COVID duties you are seeing there. And noted personalities who have visited to our institution over here. So next one is, these are the actual the project works. I have just it is a mesh of the this one. I couldn't make the proper headings to the this one my PPT because of the short of my time in preparing all these things. Anyway, these are the applied projects from since last 2020. We have the so many projects over here, applied projects. Before that, they were not that much aware about in applying all those things. So we can say it is a 1920 batch. From 1920 batch we have started applying the these all projects from government projects, startup projects like SOICs as well as M2M projects from and you're just seeing over here. And the applied projects over the hackathon, our departmental PGs including with the UGs also, UG batch. So we have applied so many projects at hackathon. Nearly 6 projects have been, hopefully we have applied over there at the hackathon. And it is just application and have been done, and the presentations were done by the PGs. And this is the completed project work at our department from the Papeshwar company. It's a sponsored project on the myostal liniment over the hemiplegic patients, and it is very recently it has been completed by 2022, and it is about to be in a publication level now. And this is a spark. We have got a very successful project has been under the guidance of Dr. Mahesh MP. So he has just applied for this one with the UG student, preclinical and clinical investigations on antihistaminic activity of Shetty, oral thin film development. So for that he has been just this project has been selected, and it is being funded for 50,000 nearly, and hackathon we have already done. And for the MSME also from our department, from under the guidance of Dr. Nirmala Sanavane, PG scholar has been applied over there. So this is the info I have just given. So these are some research activities going on since from last 2016-17 batch. These are the actual topics, research topics done by the scholars there. I'm just going through those things only, the topics. So in this different types of the, especially first batch students, they have just concentrated mainly on the Basti as well as the Virechana aspects more, and even one of the student have carried on the Nasya Karma. And these are the topics by our scholars and next batch scholars, that is 17-18 batch. And here from here the Vamana karma is also being taken for the study purpose, and many of them are related with the procedures as well as the disease aspect itself. The comparative studies have been just conducted. 6 studies have been done over here. And the 18-19 batch, again actually 18-19 batch, again much of the Vamana karma has been taken, and much of the things have been taken for the Basti itself. Basti concentration has been done, and one Vamana as well as one Virechana karma has been taken by the scholars over here in this section. And after this 3 batches, past these 3 batches, actually some innovation activities have been started taking place at our department from 1920 batch. I haven't gone through that fun over here. This is the very running batch, it is ongoing research study, but 1920 batch has taken up the study on the equipment developing, design developing. So that would be a very appreciable part over here from 1920, and it is ongoing research works by these PG scholars. These are the 6 studies going on over here. And over this we have concentrated much part on the SOP of the procedures mainly, rather than the disease aspects. And these are the 6 topics have been applied for CTRI now. The 21-22 batch already applied for the CTRI, and about to have the CTRI approval now for the enrollment and for the beginning of the research works. So these are the departmental research activities going on over here. So I have just gone through how many Bastis have been preferred by our scholars, like from since 2016 to up till now. So Basti is more preferable part they have chosen. Much of the PG scholars, like 9 students have preferred, and among that 7 are going on now. and Vamana Karma, 3 of them they have taken. Maybe Vamana Karma is more bit difficult to come in the morning time also. They must have preferred the things like that, but there is also a lot of still more works has to be done over, and one is going on here. And Virechana Karma, 4 are completed actually, and Nasya, it's 3 have been done and 4 is going on. So Nasya is also the preferable procedure, which is very easier procedure in that. And Snehana, Svedana, the 3 are completed, and Svedana 5 are completed actually. It is coming under this section. And two physiotherapies we are just conducting, 2 physiotherapeutic studies along with the disease, along with the procedures. So this is also a good development by the PG scholars. They are having the collaboration with the physiotherapy part in our PIS hospital section. And this time we have given a Jalaneti, that is with the Swastharuta department. We have collaborated one study, and instruments 2 have been completed and 2 are ongoing still, and yet to come very small instruments. Many equipments are there to develop with the collaborations of the engineering faculties. And one app development is also going on in our department. This is the actual research study from 2016 to this one. It's going on. And press note cutting, it is from the camp activity we have done. These are the some awards. I must say, I have to highlight. I have already highlighted in the earlier sections by Dr. Sonavane ma'am. So she had the Vagbhata award. So everyone had the Vagbhata award there, and she had the first person got to get the J.K. Patel Memorial Award also for the academic excellence in the ARC there. And these are the things. I have just collected these things. So many others are there, especially I didn't have that one, those clippings over here. So coming to some very last parts are have just collected these parts because the clinical side I wanted to just highlight these things. The OPD as well as the IPD data I have collected over here. 21 to 22. These are the 21 side, and these are the OPD procedures. So OPD procedures from January to December. So each procedures like Snehana to Shirobasti, the totals have been just calculated over here, and it has been projected. And Panchkarma IPD procedures 2021, it is from January to December. So Snehana to the Shirobasti. So you are just seeing over here the total is 39,105. So much of the procedures at 2021 level. And here it is a OPD data of 22 now. So OPD is total is 10,660, and the IPD data is 690 this time for the 2022 it is. And Panchakarma OPD again, the procedure OPD for 2022, it is nearly the same thing. It is maintained 1,085, and this is the procedure data. It is also maintained the same 39,000, but it increased this time, 39,000, nearly 40,000 it is. So much of the other parts are also there, I wanted to say, but because of the timings also I need to hope so. I must conclude now for this. So thank you for being with me. The action speaks much more louder than my words, because it is a panchakarma. Karma speaks than more than the word. So thank you one and all for listening me.
Yes, madam. So
Sandeep
this
sir,
was, yes, madam, very nice.
hope so it is in time or more time. Yeah, some a short time. I don't know.
No, no, it is correct in time and very innovative, very informative, and very photogenic, and what we
Okay,
say,
sir.
very proofy. But if there is any query, they can unmute themselves and can answer the question.
Yeah, anybody they can. Many
Anybody,
of them are
PG
different
student,
areas of PG
PG,
students are there. Okay, okay.
yes, yeah, yeah. And some teacher is also there. So I think, madam, there is no as such query. With your
No
permission,
problem.
shall I conclude?
Sure, sure, sir. Thank you so much for giving me again the opportunity of this one. Thank you. Yeah.
Thank